Hi everyone, welcome to Module 1 of the Living Well with Cancer-Related Fatigue video series. In this video, you're going to hear more from Ed and Sandi about how fatigue has impacted their lives. You're also going to hear from Laura, a clinical oncology social worker at the Saskatchewan Cancer Agency. She's going to share some tips and tools about how to find the support you need and be patient with yourself as you learn to live with fatigue.
In 2014, I was just having some really sharp pain in my hip. We couldn't figure out what it was. My doctor thought it was bursitis or something like that. And I sort of had tenderness in my right breast, but I, again, didn't really, I think I just dropped the ball for myself. I didn't feel like I'd want to find out if anything was going on because I had no time to stop. Like you're looking around to say, where's the person that this is happening to? Because it's not happening to me. It's just so totally unrealistic.
I was just a kid, and my dad had an accident and passed away with a tractor rollover, and that was kind of the end of my childhood. And then I started farming. It was so raw, and here was my Uncle Frank. He took off work, stayed with us, and was going to help us get started. And he said, you have to be careful. Play the cards in your hand and play them well. That has kind of been the motto of my life, because my cards have changed so often. That helped me to go through life in a fairly optimistic and happy way. Cancer in the lungs is very often has a short span, and I figured I could defy the odds, and I'd had my first surgery. It was on my left lung, and it went well. In a couple of months after that, I felt good again. And lo and behold, the cards changed a year later. I had cancer on my right side. After 3-4 months, I was healthy again. And then, I guess the third time was kind of different. The doctor says, no more surgery. I don't have enough lungs left. I need to go for treatment. So I thought I could do that, and 4 or 5 months later I would be strong again.
I almost feel like there's always a sort of a little veil that's come over, and so I can't quite see through it. Yeah, and I just can't form thought really in a lot of ways, and so rather than feeling frustrated, I don't go to my room and sleep. I just hang out in my chair for a while, because if you sleep all day with fatigue, you throw everything off, you're up all night, and you get angst about that. So I just kind of go with the flow of it now. We don't ask for help. And so for me, again, it's a very gracious, beautiful feeling for the person you ask for help, because they want to and they don't know what to do, and they want you to accept their help. And so it turns it around where, especially my family, everybody just felt so much better. Of course, it brought all of us even closer, if that's possible, because we're a pretty close-knit family, but just made much more open conversation about needs and asking for help and getting the right kind of help. But I would never have thought to do that. That's just nothing I've done most of my life.
I wasn't feeling good, I was tired, and it was my radiation treatments were hard, and I had to somehow get over it. I remember the first time I told a friend of mine how I was feeling, and he was good. He was interested. He listened. It made that easier. I think that my daughters knew it. They knew it, that I was not good. But telling them helped me to get better. And some of them were just their understanding and their hug. When the cards change that you can't even read the numbers anymore, then you need help.
So I'm Laura Hersimiuk. I'm a clinical oncology social worker with the Saskatchewan Cancer Agency. My role as a new patient navigator is to connect with all of our newly referred patients. It's really difficult for people, I think for individuals who've never experienced fatigue, especially cancer-related fatigue, to really understand what that's like. I hear from patients, feedback from patients saying that they really find it beneficial to connect with other patients who have undergone similar experiences as them. And patients have found that in a number of different ways, through support groups, from Facebook groups, through different online programs. And I find that peer support is very beneficial for patients as well. It's also important to schedule in rest time. It's important to be able to set those boundaries and say, you know what, I'm not up to having visitors today, or I don't know what tomorrow's going to look like. I'll let you know tomorrow. And I find that in this day and age, it's really hard for people to ask for help. And it's really important to be specific what kind of help you need as well. You know, it would be really helpful if someone could walk my dog every afternoon for me for an hour, or maybe someone could pick up my laundry from the dry cleaning. And you'll find that people will, respond to that and want to help. Some of the tips and recommendations I'll oftentimes give to patients is, again, setting short-term goals. And if you accomplish it, then celebrate that. Recognize that you have come a long way by accomplishing certain tasks. I think it's important to talk to family members, talk to loved ones, talk to community, talk to your friends, let them know exactly how you're feeling. Ask for help and be specific when you're asking for help. One of the things that I think it's important for patients to realize is that there are many supports out there. There's supports in the community and there's supports within their healthcare team. So it's important for them to open up that discussion. Fatigue is a real thing, and patients need to give themselves the permission to be where they are.
Cancer-related fatigue is a real difficult challenge that won't go away overnight. And learning how to play the cards in your hand, like Ed said, will take some time. I think it's really great that both Ed and Sandi decided to ask for help, even though it wasn't something that they had done often in the past. I hope you were able to see in both the stories and the tips from Laura that starting slow and being honest and clear with family and friends when asking for help will really put you on the right path to live well despite fatigue. That's it for this module, so when you are ready, feel free to watch Module 2 about pacing yourself. I'll see you soon.